Hi everyone, welcome to Current Events Articles in Psychology. I just wanted to express a warm welcome to you for joining me in this adventure. We will be reviewing current articles on various psychological topics to include human sexuality, dating, love, health and wellness, and lots of more articles. Anyway, but the best part is we are going to learn how to interpret each topic using the main perspectives in psychology, such as the behavioral model and the cognitive model, the socio-cultural model, and so on and so on. So first, I will review a particular article, then present a lecture on psychology's perspectives. Then you pick one psychological perspective and tell me how that particular perspective interprets the finding of the article. How fun is that? I am so excited to see all of your responses. And you know my motto, go where you are celebrated, not where you are tolerated. Learn lots and smile even more. So, in today's Hot Topic article psychological review, we not only have one, but we have two. The first title is Iowa woman has both legs amputated, parts of her hands removed, and will need a full facial reconstruction surgery after being brutally mauled by 3 pit bulls that left her in critical condition. This is by Alice Wright for the Daily Mail. And our second article is entitled, What are the options for dogs with aggression? And this is by Anthony D. Marinis. So, an Iowa woman has had both her legs and parts of her hands amputated and will need facial reconstruction surgery following a vicious dog attack last week. Brittany was attacked by 3 pit bulls last Friday, leaving her in critical condition. Police were called by a neighbor who reported that they could hear someone yelling for help. When an officer arrived on the scene, they found a woman being mauled by 3 dogs. After attempting to scare the dogs away, the officer was forced to shoot each dog multiple times, killing all 3. Now, when I go over the psychological aspect of this article, I want you guys not only to think about the woman who was being mauled and perhaps what was going through her mind when this was happening, but also I want you to think of the officer who arrived at the scene and had to witness this woman being mauled and then had to shoot these dogs dead. So severely injured, the woman was taken from the scene by ambulance and then by helicopter to a medical center. The mother suffered severe head trauma and had to undergo several surgeries after being admitted to the hospital. And from there, a fundraiser was set up that raised over $800 within 24 hours following the brutal attack. She had both of her legs amputated to her knees and parts of her hands. She's going to need facial reconstruction surgery. She also had serious head trauma and much more. And I will put the link for the full article below if you wish to read up more on it. Now, in an article entitled, What are the options for dogs with aggression? Let us review the following. Living with a dog who displays aggressive behavior is stressful and creates challenges. Dogs may show signs of aggressive behavior early on or develop aggressive behaviors over time. Sometimes dog owners don't realize that their dog has a behavior problem or may not recognize the behavioral signs that indicate an issue. Other owners notice behavior concerns but feel it is not that bad, or that it has a phase and will pass over time. And some dog owners know that their dog has a problem. With rare exceptions, dog owners care about their dogs, but unfortunately, many dog owners don't know how to address their dog's behaviors, and not addressing concerns early frequently causes aggressive behavior to become more severe. The consequences can be heartbreaking and life-changing. For example, the dog might injure a person or another animal with severe consequences for all involved. Now, let us review explaining aggressive behaviors according to this article. Aggression represents a spectrum of behaviors ranging from minor, posturing, or serious and dangerous attacks. Aggressive behaviors typically occur when a dog feels threatened, fearful, stressed, anxious, conflicted, concerned, protective, overstimulated, frustrated, angry, or in pain. Dogs typically display aggressive behaviors to warn, intimidate, defend, protect, and or cause harm. In effect, aggressive behaviors serve the function of increased distance or causing harm to a perceived threat or danger. Aggressive behaviors range from warning signals to overt behaviors, which include, but are not limited to, lifting the lip, growling, baring their teeth, biting without causing injury, and biting while causing injury, like the article we just went over. While others have responsibly hired professional help and have implemented the recommended behavior modification protocols to help their dog, unfortunately, other families may find their dog too risky for them and their lifestyle. Important questions for anyone who knows a dog with aggressive behavior include, is my dog a danger to my family and to me? Can I safely contain, manage, and or work with my dog in situations where aggressive behaviors are a problem? Can I safely manage, confine, and or work with my dog when I have visitors over my house? Am I willing to consistently implement safety and management strategies, such as wearing a muzzle, putting up safety barriers in my home, and recognizing and avoiding situations that will trigger my dog's aggressive behaviors? Is my dog dangerous to my children or my friends? Am I willing to make the necessary lifestyle changes that may be needed to keep my dog and others safe? If you have other animals living in your home, what is their quality of life? Are the other animals at risk physically, emotionally, or psychologically? Do my dog's behavior affect my family to the point that we no longer enjoy his company? Do my lifestyle and living situation allow my dog to live happily, fulfilled, and safe? If management fails and my dogs become loose, will a family member, a visitor, a neighbor, a child, or other animal become seriously injured or worse? And of course, the example is the article we just read before this one. Now, what options do you have? You can first seek assistance and advice from a qualified dog trainer or behavior consultant. Consult your primary veterinarian. Consult a fair fee certified veterinarian or consult a board certified veterinarian behaviorist. Return your dog to where he came from, or rehome your dog to a responsible rescue or sanctuary. And in more challenging or serious situations, consider humane behavioral euthanasia. Now, in cases where the dogs actually bite or maul someone, usually the authorities have that dog put down. Humane behavioral euthanasia is a controversial and painful topic. Professionals who are experienced with severe behavioral problems make this recommendation only in extreme cases, such as when the prognosis for success is poor. The dog's behavior endanger the lives of family members or other animals or the community. The dog cannot be safely rehomed. Or if the dog is mentally suffering, the term humane is used because the dog is allowed to pass peacefully, usually with the owner present. Now, in the upcoming lecture in regards to abnormal psychological perspectives, I don't only want you to take the perspective of the person being mauled, but also I want you to view the perspective perhaps of the dog owner. And not only that, but also the emergency respondent, whether it's coming to the rescue of the person being mauled. Okay, let us now review the lecture on psychological perspectives of abnormal behavior. In this lecture, we will review the different perspectives on abnormal behavior. Those in the field of abnormal psychology study people's emotional, cognitive, and or behavioral problems. Abnormal behavior may be defined as behavior that is disturbing, which is socially unacceptable, distressing, maladaptive, which is self-defeating, and often the result of distorted thoughts, which are cognitions. There are a number of different perspectives used in abnormal psychology. While some psychologists or psychiatrists may focus on a single viewpoint, many mental health professionals use elements from multiple areas in order to better understand and treat psychological disorders. Let us first begin with the medical perspectives. This approach to abnormal psychology focuses on the biological causes of mental illness, emphasizing understanding the underlying cause of disorders, which might include genetic inheritance, related physical illnesses, infections, and chemical imbalances. Medical treatments are often pharmaceutical in nature, although medication is often used in conjunction with some type of psychotherapy. Okay, so those who hold a medical perspective focus on biological and psychological factors as causes of abnormal behavior, which is treated as a disease or mental illness and is diagnosed through symptoms and cured through treatment. Hospitalization and drugs are often preferred methods of treatment rather than psychological investigation. Recent research linking biochemical disorders with some abnormal behaviors has provided some support for this approach. Okay, next, let's move on to the psychodynamic perspective. This perspective has its roots in the theories of Sigmund Freud. The psychoanalytic approach suggests that many abnormal behaviors stem from unconscious thoughts, desires, and memories. While these feelings are outside of awareness, they are still believed to influence conscious actions. Therapists who take this approach believe that by analyzing their memories, behaviors, thoughts, and even dreams, people can uncover and deal with some of the feelings that have been leading to maladaptive behaviors and distress. So again, the psychodynamic perspective proposed as an alternative to the medical approach evolved from Freudian psychoanalytic theory, which contends that psychological disorders are the consequence of anxiety produced by unresolved, unconscious conflicts. Treatment focus on identification and resolution of the conflicts. Now, let's move on to the behavioral perspective. This approach to abnormal psychology focuses on observable behaviors. In behavioral therapy, the focus is on reinforcing positive behaviors and not reinforcing maladaptive behaviors. The behavioral approach targets only the behavior itself, not the underlying causes. When dealing with abnormal behavior, a behavioral therapist might utilize strategies such as classical conditioning and operant conditioning to help eliminate unwanted behaviors and teach new desired behaviors. So, those espousing a behavioral perspective contend that abnormal behavior results from faulty or ineffective learning and conditioning. Treatments are designed to reshape disordered behavior and using traditional learning procedures to treat new, more appropriate, and more adaptive responses. Okay, so moving on to the cognitive perspective. The cognitive approach to abnormal psychology focuses on how internal thoughts, perceptions, and reasoning contribute to psychological disorders. Cognitive treatments typically focus on helping the individual change their thoughts or reactions. Cognitive therapy might also be used in conjunction with behavioral methods in a technique known as cognitive behavioral therapy, or CBT. So, according to the cognitive perspective, people engage in abnormal behavior because of particular thoughts and behaviors that are often based upon their false assumptions. Treatments are oriented towards helping the maladjusted individual develop new thought processes and new values. Therapy is a process of unlearning maladaptive habits and replacing them with more useful ones. Okay, and the final perspective of today's lecture is entitled The Social-Cultural Perspective. From the social cultural perspective, abnormal behavior is learned within a social context ranging from the family to the community to the culture. Cultural variables acquired through learning and cognitive processes are believed to be important and produce an abnormal behavior. Anorexia and bulimia, for example, are psychological disorders found mostly in Western cultures, which value the thin female body.